Hello everyone, I'm Charlie Tolhurst and welcome to a very important video. Today is a COVID-19 update with me. I'd just like to say very quickly before I start the update, I am in good health. I feel as fit as a butcher's dog, and of course, as you may know, I'm currently at the moment in self-isolation due to a positive COVID-19 case that has been reported at the college I go to. So I am working from home, as you are seeing now. But of course, like many other people in this country, I'm having to follow the rules, and so are you as well. So we're going to get onto the news from the pandemic. I just want to quickly report that 20,252 new cases have been reported in the last 24 hours. That takes the total number is still well over 1 million. Patients admitted to hospital in the last 24 hours has increased to 1,737. That takes the official total now to 16,444 in the UK. And 1,426 of those are on mechanical ventilation beds. And sadly, the number of people that have died from the COVID-19 disease, I have the figures for you here. 54,286 people have sadly died. It's an increase of 511 fatalities. And we mourn the loss of all these fatalities. This is a loved one, a family member. It is a horrific time for everyone right now. Now, the latest news from the pandemic, which I'm going to get onto now, whilst I'm here, from my coveted desk, is that there is encouraging news in our fight against COVID-19, as the government have apparently confirmed that vaccinations could be underway for all adults by the end of January, apparently. Now, there is promising news for the UK at the moment, given coronavirus vaccine news, which is very important as we speak now. The UK is currently setting up vaccine hubs ready for rollout, apparently. And the process of approving the Pfizer vaccine has begun, and delivery could start from as early as December. That is what the Health Secretary has said. And this is a video here of exactly what Matt Hancock had to say about the coronavirus vaccine. And it's a very encouraging news to hear. Have a listen to this.
I know everyone wants to know about the timing and the speed of the rollout. That will depend on the speed at which the vaccines can be manufactured. We know that the manufacturing process for all vaccines is difficult and uncertain. So I've asked the NHS to be ready to deploy at the speed at which the vaccine can be produced. What I can say about timing is that if, and it still is an if the regulator approves a vaccine, we will be ready to start the vaccination next month, with the bulk of the rollout in the new year. We're heading in the right direction, but there is still a long way to go.
Thank you there to Matt Hancock, and the news there was quite encouraging actually, that there looks like a vaccine could be ready early next year. I mean, fingers crossed it needs to go through clinical trials, obviously, and it's got to be effective as well when it comes to injecting the jab on humans, but it looks very encouraging. Now, one of the news that I want to cover today in this little COVID update, this isn't going to be a COVID update as well. I wanted to quickly mention about Brexit whilst I'm here. Because, as you may know, the negotiations this week between the EU and the UK have stalled after a member of Michel Barnier's negotiating team has tested positive for COVID-19. So, really, we're in a position now where we leave the EU on WTO terms without a deal. Now, obviously, there is going to be those people who want the deal, obviously. But at the moment, the Prime Minister's bill does break international law. And it's clear that without these negotiations going on, that because they've stalled due to a positive case, the government will have to delay the transition period, which ends very soon. It ends at the end of next month. So this is going to be crucial. So I thought I'd mention that. But back onto the main news of the pandemic. I thought I'd mention that news previously because the Brexit news, there was, of course, a member of Michel Barnier's team who's tested positive for COVID-19. But onto some more news now. And this news is very important for COVID, actually. And it's not just in the UK, because it's actually been around the world. As a lot of people have already known, it is a very difficult time for everyone. And as today, during the briefing, both scientific advisors actually appeared via a video link. Now, that was in the briefing, Professor Stephen Powis and Professor Jonathan Van Tam. Like me, they are both self-isolating after, of course, Jonathan Van Tam was said due to household contact. Stephen Powis, I believe that a member of his family tested positive, so he's had to officially quarantine himself for 14 days. So, yeah, this is a very worrying time. But both the scientific advisors were on Zoom today, and this led up to a very interesting briefing between the scientific advisors on Downing Street today. And I have to say, according to what I heard from the scientists today, the news about falling cases are beginning to level off now, which is good news. Because we did see a slight rise the other week, but it is levelling off, which is the good news there. Also, in that news regard as well, the R number, the rate in which the virus is spreading, the rate of infection is known as the R number. The latest publications were sent out by Sage today. The R number is now between 1 and 1.1. This is encouraging. Okay? This is encouraging news to see that the epidemic is starting to slow down. So hopefully, fingers crossed, we're able to get this epidemic under control. But it's going to take a lot of effort to get this under control. So it's really important that everyone follows the rules. Wash your hands, cover your face, make space, and if you have symptoms, get a test. If you're in contact with anyone that tests positive, or if you're alerted by NHS Test and Trace, self-isolate immediately and quarantine. This is exactly what you have to do. I myself am doing it till next Friday. And I know self-isolation's a boring thing, but you have to do it. And working from home is a very weird sensation. Having to talk to people through video conferencing and technology. But let me say, guys, this is the only way we can stop the spread of this virus. We need to slow it. And if you're outside, please wear a face covering where recommended as well. This is a very important thing, and we really need you guys to start obeying the rules now. So, it's a very important time for people. And before I finish this little update that I'm doing now on COVID, I just want to give a message to the British people and give a message to all these people that are in businesses right now. You'll never walk alone. Because sadly, many businesses, self-employed, sole traders, are unfortunately losing their jobs. This is a very difficult time for everyone. As I know, the hardship of self-isolation, of quarantine, of people shielding right now, getting lower income support and on furlough, receiving on the government's coronavirus job retention scheme, it is very difficult. And many of these people are really struggling to keep their businesses afloat. So I urge you guys now, we will always stay together and this country will come through this crisis together. I know this is the worst global health crisis we've had for a generation, but honestly, we can get through this together, and we can show lots of courageousness and determination to do so. That is the end of tonight's COVID-19 update. Thank you so much for watching. Take care. Goodbye. If you have any questions about this video, please comment down below.